Yeah, so I'll speak more specifically from the TMT era from using tri-modality therapy as a radiation oncologist. So, the goal of bladder-sparing therapy is to preserve the bladder, to keep the bladder. And so we're always concerned about, what does it look like with, keeping your bladder, having your bladder intact, maintaining your bladder after having muscle-invasive bladder cancer. So, it's always important to counsel the patient that when you have a bladder remaining after bladder-sparing therapy, it's really important to stay on top of your follow-up. So you will have, continued cystoscopies. We're still going to be going up into the bladder and looking around to make sure everything looks clear, and things like that. That's different than if you have a radical cystectomy, meaning you take out the bladder. That's very different. So that's just something to keep in mind. You of course have scans, and you're going to be followed very closely. So that's one aspect. And then other things, we're always concerned about function, long-term functionality, and thankfully we have data showing that long-term functional outcome after bladder-sparing therapy or tri-modality therapy is actually very, very good. And from a quality of life perspective, patients actually, there was a study that I'll be talking about in my talk tomorrow that compared patients that had radical cystectomy to TMT in terms of quality of life, and they had improvements in terms of sexual function, body image, and feelings about their overall cancer outcomes. So there was improvements from a TMT perspective. So that's very reassuring, but definitely something to think about in terms of these long-term survivors. We absolutely want to always stay on top of that.